Hello everyone, welcome to sqadia.com, and now in our first section of the benign lesions of the ovary, we will talk about ovarian enlargement. We will talk about the ovarian enlargement as a result of non-neoplastic growths, about the follicular cyst and corpus luteum and lutein cyst. First, the ovarian enlargement. Ovarian enlargement can be due to non-neoplastic causes or it can be due to neoplastic causes. This here, if you see in this diagram, this is the enlarged ovary and this is the normal sized ovary, and that's the section of the normal ovary. So this ovary is the normal size, and if you compare it to this is the enlarged ovary. Ovaries are an important structure of female reproductive system. They are attached to the fallopian tube. This is the fallopian tube that is attached to the uterus. So fallopian tube has on the end there is the fibrated end of the fallopian tube, and in this fibria there is the ovary present, and ovaries are the very important sex organ of female reproductive system, and they produce the hormone estrogen and progesterone, and these are responsible for developing secondary sex hormone characteristics of the female. Ovaries are very important for the release of ova is produced inside the ovary, and with the release of ova there is onset of menstruation, and once the ova is fertilized then there is conception or pregnancy. The production of ova usually occurs at menarche, which is the age at which the menstruation starts. So with the production of the ova, there is beginning of the menstrual cycle. So ovaries are very, very important female organ, and any abnormalities in the ovaries which can be non-neoplastic or neoplastic can cause different abnormalities in the female system. So enlargement of the ovaries which can be non-neoplastic or neoplastic. Non-neoplastic causes of the ovarian enlargement are can be due to follicular cysts. It can be due to corpus luteum cyst, theca lutein and granulosa lutein cyst, and it can be due to polycystic ovarian syndrome, or it can be due to endometrial cyst. So all these are the non-neoplastic causes of ovarian enlargement, and mostly these are the cysts in the ovaries that can cause the enlargement of the ovaries, and sometimes these cysts become really, really huge and big. So follicular cysts are the type of functional cysts. Follicular cysts are produced as a functional cyst in the follicles of the ovaries, and these follicles are the structures in which the ova are produced. So in the follicular phase of the menstruation, we have follicles, and sometimes when the fluid is present in those cysts, they can lead to follicular cysts. And rupture of these cysts again cause local inflammatory reaction, and these cysts are sometimes rupture when the menstruation occur. So follicular cysts are the functional normal cysts present sometimes in the follicles of the ovary. Then the corpus luteum cyst. Corpus luteum is after the ova is released from the follicles of the ovary, the follicle becomes the corpus luteum. And this corpus luteum produces the progesterone and brings about the secretory changes in the endometrium of the uterus. So formation of cyst in the corpus luteum leads to the corpus luteal cyst. And again, these cysts usually disappear or regress with menstruation, but sometimes takes up to 3 months for the complete disappearance of the corpus luteum cyst. Then the lutein cyst, theca lutein or granulosa lutein cyst again are the functional type of cyst, and to be diagnosed as functional cyst, lutein cyst, usually they should be up to 3 centimeter in size to be diagnosed as the lutein as the functional cyst. So lutein cysts, they are the cysts again filled with the clear fluid, and they should be 3 centimeter in diameter to be the labeled as the functional cyst. Then another type of cysts that are formed in the ovaries are polycystic ovarian syndrome. In polycystic, as the name shows, multiple cysts are formed in the ovary. It's a common type of syndrome in which multiple cysts are present in the ovaries. Usually the females come to the office, to the doctor with the complaint of infertility, and they have facial growth like men. They have beard and they have mustache and they have very muscular body. So they come to the doctor's office, and when further testing is done and when the ultrasound is performed, usually there is multiple cysts present in the ovary, and this is known as the polycystic ovarian syndrome. And the treatment is very important. Usually it's hard to get fertilization back in polycystic ovarian syndrome, but treatment is done, and in some patients they can conceive easily once the treatment is started, but this is not the case in every patient. And then again, the endometrial cysts. Endometrial cysts are the cysts which are present in patients who have endometriosis. Endometriosis is the condition in which the endometrial tissue is present outside the uterine cavity, and when this is present in the ovary, it can lead sometime to formation of cyst in the endometrium of the ovary. So these are all the non-neoplastic causes. These are the non-neoplastic causes, and mostly they are the different types of cyst present in the ovary. Some are functional like follicular cyst, lutein cyst. Some are not functional like polycystic ovarian syndrome, endometriotic cysts. The features of the functional cysts of the ovaries, usually they are related to the hormonal changes or hormonal disorders, and once that hormonal disorder is corrected, usually these functional cysts, they disappear or shrink. They rarely become complicated, so complications are not very common with the functional cysts. Sometimes they are confused with neoplastic cysts, but they can be distinguished from neoplastic cysts by the following features, which are normally they are 6 to 8 centimeter in diameter. So functional cysts are about 6 to 8 centimeter in diameter. They are usually asymptomatic. Neoplastic cysts are not asymptomatic, but functional cysts are usually asymptomatic, 6 to 8 centimeter in diameter. There is spontaneous regression of these cysts once there is correction of the disorder like hormonal factors or other factor. Once they are corrected, the regression of the functional cyst occurs. It's usually unilocular, not multilocular, so it's unilocular. Contains a clear fluid unless there is hemorrhage presence or bleeding occurs in the cyst. The fluid in the cyst is clear. That's not usually the case in the neoplastic cyst, which is mostly it's hemorrhagic fluid or blood is present. Then lining epithelium correspond to the functional epithelium of the unit from which it occurs. So the epithelium lining of the cyst, functional cyst, is usually the same as the epithelial lining of the unit from which it grows. So these are some features that helps to differentiate between functional cyst from the neoplastic cyst. Very important is the factor that fluid is clear, and the another factor is once the underlying cause of the functional cyst is removed, usually they can regress or they can become smaller in size. These are the follicular cysts. You see follicular cysts. Follicular cysts are the functional cysts. So these cysts usually regress once the underlying cause is removed. Now the management of the follicular cyst, if it's less than or equal to 3 centimeters, usually no further investigation is required. If it's less than 8 centimeters unilocular with normal CA125 levels, usually the treatment is, follow-up is important within 3 to 6 months. So if less than 3 centimeters, no treatment, no investigation. But if it's more than 8 centimeters and CA or carcinogen antigen CA125 is the levels which are measured in carcinomas, and if it's less or if it's normal, then usually the follow-up is done in 3 to 6 months to find out if it's increasing in size or if it's getting bigger. Then we should do the further follow-ups or treatment. CA125 levels are different in different type of cysts. Then in epithelial tumors, usually CA125 is more than 35. The normal level of CA125 is from 0 to 35 units per liter. If it's more than that, it's in epithelial tumors, usually it's more than 35. In serous adenocarcinoma, it's about 80% in CA125. In mucinous adenocarcinoma, there is 69%. In endometriosis, it's about 75%. Clear cell, 78%. And in undifferentiated adenocarcinoma, it's 88%. So CA125 levels are important. Usually it's increased in the carcinoma or neoplastic conditions. This is the corpus luteum cyst, how it appears. This is the normal ovary, and this is the normal ovary, and this is the corpus luteum cyst. As I mentioned earlier, corpus luteum cyst is the cyst formed in the corpus luteum, which is the tissue or structure formed after the ova is released from the follicle, and then corpus luteum secretes the progesterone and brings the secretory changes, and once the menstruation occurs, it regresses or disappears. But if the conception occurs, or if the ova is fertilized, then the corpus luteum continues to produce progesterone, and that's important for the maintenance of pregnancy. So if the fluid is filled in that corpus luteum, or if the cyst is produced in the corpus luteum, usually it disappear, or at the same time when the menstruation occurs. And for the complete disappearance of the corpus luteum cyst, it usually takes about 3 months. These are the, again, changes. This is the picture of the ovary with cancer. It's huge growth in the ovary, and usually the cancer is diagnosed with the biopsy removed from the tissue removed with the biopsy, and usually by the laparoscopic examination tissue is removed. If there are malignant changes, then it is ovary with the cancer, and that's how it appears. The lutein cysts are the functional cysts, and to be diagnosed as the functional cyst, lutein cysts should be more than 3 centimeters in diameter, and they are usually filled with the clear fluid. Again, this is the specimen removed with the surgery, and these are the lutein cysts, big, huge lutein cysts. So that was all about the ovarian enlargement, neoplastic and non-neoplastic causes of ovarian enlargement, and how they are managed and differentiated. So thank you for watching sqadia.com.